Okay, my name is Heather Ussery. I'm in nursing 1119. If you could do a room scan, please.
Okay.
Okay, and today I'll be doing a musculoskeletal and neurological function test. And before I came in to see my patient, I checked their chart for the orders and allergies and reviewed the vital signs. And so I'm performed hand hygiene now, and we have a privacy in the room. Okay, hi, my name is Heather, and I'm going to be your nurse today. Could I get you to give me your name and date of birth, please?
Alexis Wiki, April 3rd, 2003.
Okay, and I'd like to go ahead and check your armband and confirm. Okay, now Alexis, do you go by Alexis or do you have a nickname?
Lexi.
Okay, Lexi. So what I'm going to do today is just assess some of your neurological function with your nerves and your skeletal function, muscle tone, and things like that. I'll be doing a few tests. It should be very easy, but if you have any questions, just let me know. Now, can you kind of assess, can you give me the location of where we are today?
The hospital.
Okay, and can you give me what day of the week it is?
Friday.
Okay, so your short-term memory is good. Can you tell me what year you graduated high school?
2020.
Okay, great. Now we're going to get started with the test, and first thing I'm going to get you to do is stand up, if you will. And I'd like you to go ahead and take a few steps this way, take about 5 or 6 steps, and then turn around and come back to me.
Okay.
Okay? Looks good. Gait looks very good. Arms and legs swing in opposite directions. So now I'm going to do some tests on you to get your balance. Okay, the first one I'm going to do is called Romberg, and I'll stand right here just to keep you safe, but will you close your eyes, please? Okay. And I would count to 30 and assess Lexi's balance. Looks good. No abnormalities, so you can open your eyes. And now turn to the side. I'm going to take a look at your spine and check for evidence of any abnormalities like lordosis, kyphosis, or scoliosis. Lateral view is good. Go ahead and bend over. Symmetry around her spine. Now what I'd like you to do now is go ahead and sit down back on the bed. Oh, one more balance test, so sorry. What I'd like you to do is lift your right leg up and touch it to right beneath your knee and follow your heel down to the floor. Okay, and try again. Okay, great, thank you. Now sit down and go ahead and scoot back so that your feet are off the floor. Okay, so first thing that we're gonna do, I'm gonna get you to do a test with me where I'll hold my finger in front of you, and if you'll point and touch my finger with your pointer finger and then bring it back to your nose, and then do that as I move my finger around, okay? Okay, that's good. Now I'm going to get you to focus on my finger, keep your head still, and follow my finger with your eyes. No abnormalities. You did a good job. Go ahead and blink a little bit. So, okay, next one I'm going to get you to do is close your eyes, and I'm going to put a scent in front of your nose. Tell me what you smell.
Lemon.
Okay, perfect. Now, if you'll cover one of your eyes, either one first, and read the Snellen chart over here and read the smallest line that you can read.
A, B, C, D, E.
Okay, and now repeat with your other eye.
A, B, C, D, E.
Okay, looks good. Good, good. Okay, now that means you read the lowest line. Your vision is 20/20. You're 20 feet from the chart. Did that perfectly. Okay, now what I'm going to do is I'm going to check your pupillary function, and I'm going to shine a light in your eye and check this. Look over my shoulder, and I won't be in there long. Okay. Perfect, and noticeable consensual dilation. Constriction. Noticeable consensual constriction. So thank you. Okay. Now I'm going to get you to open your mouth. Okay. And stick your tongue out and say ah.
Ah.
Ah, looks perfect. Now if you'll stick your tongue out and move it around. Okay, perfect. Looks good. Now, what I'd like for you to do is, can you smile and now frown Okay, can you puff out your cheeks and move your eyebrows up and down? Okay, looks good. Okay, now I'm going to take a test with your eyes closed. With your eyes closed, I'd like for you to tell me what part of your face I'm touching with this cotton ball.
Left cheek. Right cheek. Forehead. Chin.
Okay, now I'm going to put that down right there. I'll come back to it in just a second. Now I want you to try to raise your shoulders against my pressure. Okay, looks good. Okay, cranial nerves are intact. Now I'm going to get you, we're going to use this again if you'll, oh, one more check, I forgot. I'm going to get you to cover one ear, and I'm going to whisper something in here, and if you'll repeat it for me.
XYZ.
Okay.
ABC.
Okay, perfect. Now we've got cranial nerves intact. Next thing we're going to do is test some of your accessory sensory perception.
Okay.
If you'll close your eyes again, and if when you feel this on your extremities, just say yes if you feel it. Okay.
Yes. 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 Yes.
Okay. You can open yes, and if I in the clinical setting, I would repeat that with a sharp object to test your sharps perception as well. So now, if we could get you, we're going to get test some of your musculoskeletal and your range of motion. I'd like you to raise one arm as high as you can go, and now come back down, and now repeat that while I apply some pressure.
Okay.
Okay. And now you can come back down, and if you'll do your bicep like that and bend at your elbow. Okay, looks good. Do it again while I repeat pressure. And now please flex your wrists up and down. Okay. Now try again with pressure. And flip over. Okay. Same with this arm. Raise it up. Always with that pop. Okay, now try again. Okay, and now flex your elbow. Okay, now again with pressure. Okay, and now flex your wrist, please. Okay, and if you'll turn over. Okay, that looks good. Now I'd like to get your radial pulses. You can turn your hands this way. And I'm just kind of assessing for symmetry. Symmetry and amplitude are good bilaterally. And if you'll just flip your arms over like this, back and forth. Okay, looks good. Now can you flex and constrict your hands like that? Good. And now if you'll grab onto my fingers and increase the pressure. Squeeze as hard as you can. Okay. Now I'd like for you to flex your leg out like that, one at a time. And I'm going to do the same thing I did with your arms. Now flex again against my pressure. Okay, now flex your foot, your ankle, and then down. Okay, and now against pressure. Okay, same with this leg. Flex. Push against it. And up and down with your ankle. Okay, now flex against it. Okay, looks good. Now I would assess your dorsalis pedis pulse. I won't take your shoes off for now, but in a clinical setting we would do that. I'm going to assess your reflexes on your knee. Okay, so just relax. Oh, there we go. Okay. Oh, there we go. Okay. And I think that's about it. Lexi, do you have any questions?
I don't.
No? Okay. Well, I'm going to go and document these findings. When I leave here, I'll wash my hands immediately, document immediately, and you can scoot back down so that your feet are on the floor so that you're in a safe position. And if you need anything, call light is within reach. Abby, if you'll scan the room.
Yeah.